Okay, so a little bit more about complexity. Even simple interventions can have complex impacts. And so it's generally important and necessary to set boundaries on your evaluation. You have to decide what effects are you going to include, which effects are you not going to include. Sometimes it'd just be impossible to try and include everything. You also have to decide what time period you're going to consider. Again, there's a possible difference here between public health and other health interventions. Possibly the time periods might be potentially longer when we're looking at populations rather than individuals. As I've said, quite often, quite frequently, public health interventions will not be simple. We're going to look at an example shortly where it couldn't be simpler. I'm going to look at speed limits at one point, where you just lower the speed limit. Very simple intervention in principle, but then it could have complex effects. But as I say, many times public health interventions are far from simple, they're quite complex. Now, this adds additional challenges, because when your intervention is complex, it becomes an issue which bits of the intervention are providing the benefit. Now, to repeat, this isn't a problem when we're testing a new drug. The new drug is a simple intervention. We don't have to ask ourselves, we don't even have to ask ourselves why it works. If it does work, good, but we don't even have to understand why the drug works. But if we have a complex intervention with different elements, it becomes a very natural and important question: which bits of this intervention are, as it were, doing the work? Which bits of the intervention are achieving the outcomes? Because then you may want to adjust the intervention, put more emphasis on some elements than another. So with public health, what we quite often have is a process evaluation as well as an evaluation of outcomes. Because frequently there is complex processes going on. So this is a bit small. Of course, if it was bigger, I couldn't show it. This is a healthcare intervention. If you can read this on your handout, you don't need glasses. But I can take you through it. This was developed by a colleague of mine at the School of Hygiene and Tropical Medicine, Rebecca Steinbach. And what she's tried to trace out are what she's described as the public health impacts of reduced street lighting. Now, this is a real policy. I suspect primarily driven by a desire to save money. I suspect. But if you reduce street lighting, you're not just going to save money. You're going to have a lot of different effects. And the issue then becomes the aggregate of these effects. How does that compare to the money you save? So everything is about this reduced street lighting. Where to start? Well, what do we first of all think of if we reduce street lighting? What would you think of first of all? Crime. And that's interesting, because that's what a lot of people immediately think of. They think if we reduce street lighting, probably going to be more crime. Or if not actually more crime, more fear of crime. So we've got that. Reduce street lighting, darker streets. So darker streets, fear of crime, actually perhaps more crime. It's not crime, but another thing you might think of is road traffic accidents, if street lighting is poorer. Maybe if you were old and infirm, you would have come up first of all with falls and things like that. Increased likelihood of falling. But it's not just that, it's things like fear of falling, fear of tripping is then going to affect people's behaviour, and so it's going to be changes in mobility. And maybe some individuals, because they're fearful of falling or slipping, go out less often at night. Or crime, actual increases in crime, or the thought that crime might increase could lead to, again, changes in behaviour. Now, this is going to have an effect potentially on nighttime economy. If people are not going to go out so much, shops that are open late who make money from selling things later on at night are going to start doing less well. If there is more crime, or indeed if you fear more crime, people may then start spending more on their own security. So what started as an attempt to save some money by reducing the lighting is now leading to other people using more resources to compensate. So you could imagine a situation, indeed, where the lighting is coming down, the brightness, and immediately people start installing more lights themselves. So you stop public lighting and increase private lighting. What else will be effects? Well, energy use affected. That may even be one of the reasons for introducing it, but which may then have implications for GHG as greenhouse gas emission. So benefits there possibly, smaller carbon imprint. Flora and fauna. If we've got less lighting, this might encourage different sorts of animals or creatures to inhabit particular areas. Now, depending how you feel about different creatures, this may be a good thing or a bad thing. But it's not all bad. What about some health effects? Now, the suggestion is sometimes we have too much artificial light, and as a consequence, it's disruptive to people's circadian rhythms, and people's sleep patterns are influenced. And so the suggestion, indeed, this is a suggestion that ultimately there can be impacts on diseases such as cancers, diabetes, heart disease, and so on. A little bit more exotically is this bit here. Reduce the street lighting and suddenly we seem to have starry nights. Now, I don't know about Kyoto. I haven't looked up at the sky at night, but I guess Kyoto is a bit like London. You can't see any stars. There's too much artificial light. So interest in astronomy is possibly not great. When you look up and see the stars, maybe you do begin to think about, oh, I wonder if that's Orion, or is that Mars, or whatever. You take an interest. Perhaps there's impacts on sort of spirituality. Anytime I do get the chance to see a genuinely starry night, I suddenly realize how small, insignificant, not just I am, but we are. Now, when you don't see these stars, you're just a bit less likely to think about that. So this might have impacts on feelings about where you live and how you regard the local area. We touched on most of them, yeah. So there's the crime, there's road traffic, there's some health, some things to do with being able to actually see the sky, energy use changes and consequences. Now, once you start looking at that sort of wide range of potential consequences or effects from a rather simple change, changing the lighting, of making the streets a bit darker, you begin to see how this is quite hard to evaluate. And you have to put boundaries around it. So I imagine if you wanted to evaluate reduced street lighting, you're probably going to say, well, this is interesting, the starry nights, but I'm not going to include it. On the other hand, you might say, well, that's an interesting one. We could ask people's willingness to pay to be able to see the planets and the stars. I guess the sort of crime nexus you're definitely going to want to include. I think there's a real interest in road traffic as well. And of course, both crime and road traffic have potential health consequences. These health consequences also would be of interest, although how easy or difficult are they going to be to establish the link between reducing street lighting and changes and impact on these health states? In a way, crime's a bit easier. I mean, there's still challenges, but you can see your way to. One expects the change in crime levels will be fairly immediate following a change in lighting. These health consequences may be much slower changes. So what would you do? Would you just say, it's too complicated, I'm not going to do it? Nice idea, but I'm not going to do it. That's an example.